Okay, imagine this scenario. Someone has, say, a skin graft for a burn, or maybe a more complex flap surgery after an accident. Things seem okay at first, but then complications. The graft just isn't taking, or the flap is, well, struggling. That hope for recovery, getting back to normal life, it starts to feel really uncertain. It's tough physically and emotionally. So, in this deep dive, we're looking at something pretty interesting, a medical treatment that can really turn things around in these situations. We're talking about hyperbaric oxygen therapy and specifically how it helps these compromised grafts and flaps survive and even thrive.
It's a fascinating area and really important, just so we're all on the same page. Skin grafts, that's when you move a piece of skin from one part of the body to another.
Yeah.
Pretty straightforward. Flaps are a bit more involved. They usually include skin, fat, maybe some muscle, even blood vessels. And the key thing is they're moved but stay partly connected to their original blood source, at least initially.
Right, exactly. And look, whether you're in the medical field or just curious about this stuff, we want to make it clear. We're not going to drown you in jargon. The idea is to pull out the key info on why and how hyperbaric oxygen works here. Our mission today really is to get to the core of it, maybe uncover some surprising aspects based on the research we've looked at.
So where do we start? I think we need to understand the problem first.
Yeah.
Why do these grafts and flaps sometimes run into trouble? Why do they get compromised?
Okay, yeah, let's dig into that. There are a few culprits. A big one is just not enough blood getting to the tissue that's ischemia. Then you've got infection risk, always a concern. Swelling, which doctors call edema, that can cause problems too. And sometimes the tissue itself just isn't in the best shape to begin with. Any of those can really stop a graft or flap from knitting properly, from surviving where it's been moved.
And underpinning all of that is something fundamental: oxygen. Our bodies absolutely need oxygen for healing. It's easy to forget, but things like repairing tissue, making new cells, producing collagen, that's the protein that gives structure.
Right?
Even how well our immune cells fight off bugs, it all depends heavily on having enough oxygen right there in the tissues.
There are actual numbers for that, aren't there? Like levels they measure.
Yes, exactly. We talk about oxygen tension or partial pressure. For just basic cell function, you generally need it above 30 millimeters of mercury. For making collagen, which is vital for strength, the sweet spot is actually between 20 and 60. And interestingly, in areas where you have lots of immune cells working, like macrophages cleaning things up, or in dead tissue spaces, the oxygen level can plummet to almost zero.
Wow. And you mentioned even in normal healing, the oxygen levels aren't always perfect across the whole area.
That's right. It can be quite patchy. Heterogeneous is the technical term. Sometimes it's just suboptimal, even when things are generally going okay.
Which is where this therapy comes in.
Precisely. Hyperbaric oxygen therapy. It sounds complex, but the basic idea is simple.
Yeah.
You breathe pure, 100% oxygen inside a special chamber where the air pressure is higher than normal sea level pressure.
Okay, breathing pure oxygen, higher pressure. What's the actual physics behind why that helps so much? How does that make a difference down at the tissue level?
It relies on a basic law of physics, Henry's law. Essentially, it says that the amount of gas that dissolves in a liquid is directly proportional to the pressure of that gas above the liquid. So when you increase the pressure in the chamber, you force much, much more oxygen to dissolve directly into the liquid part of the blood plasma.
Not just carried by the red blood cells.
Exactly. Normally, oxygen hitches a ride on hemoglobin in red blood cells. This is different. The pressure physically pushes large amounts of oxygen straight into the plasma itself, and the increase is dramatic. At 2 atmospheres absolute, a pretty standard treatment pressure, the amount of oxygen dissolved in arterial blood plasma can jump way up, maybe to 1,000, even 1,250 millimeters of mercury.
Whoa, that's huge compared to normal levels.
It really is. And this is the critical part. At these pressures, the oxygen dissolved just in the plasma can be almost enough to meet the basic needs to the tissues without relying on hemoglobin. This means oxygen can get delivered, even if the red blood cells aren't reaching an area well, or if there are barriers like swelling, that edema we mentioned, blocking the usual path. It helps overcome those diffusion barriers.
Okay, that makes sense. You're creating this super oxygenated plasma that can get places the normal system can't. So how does that directly help a struggling graft or flap? What's happening?
Well, first and foremost, it directly tackles that ischemia, the lack of oxygen. This dissolved oxygen can reach those oxygen-starved cells deep within the graft or flap, areas where blood flow is poor. It essentially increases the distance oxygen can travel from the nearest functioning capillary through the tissue fluids, past the swelling, to reach the cells that desperately need it.
Like giving it a push to get where it needs to go. What about the actual healing process itself? Does it stimulate that?
Oh, absolutely. On a cellular level, hyperbaric oxygen acts like a stimulant for several key repair processes. It encourages fibroblasts. Those are the cells that build connective tissue to multiply. It helps epithelial cells grow, which are crucial for covering the wound, for regenerating skin. It also aids in making the extracellular matrix, which is like the scaffolding for the new tissue.
And collagen, you mentioned that needs specific oxygen levels?
Yes, exactly. Collagen synthesis and cross-linking, which gives the tissue strength, works best in that 20-60 millimeters of mercury range. Hyperbaric oxygen can help push the tissue oxygen levels into that optimal range, even in areas that were previously starved.
Okay, so better oxygen supply stimulating the building blocks. What about the swelling, the edema? You mentioned that was a problem.
Right, and there's evidence, studies have shown, that hyperbaric oxygen can actually help reduce that swelling that often happens after blood supply has been poor post-ischemic edema. Reducing the swelling itself can then improve microcirculation, allowing better blood flow, so it kind of creates a positive feedback loop for healing.
That's helpful. Now, infection is always a major worry, isn't it? With grafts, flaps, any surgery, really. Does hyperbaric oxygen do anything there?
It does, and this is a really important benefit. It works on a couple of fronts. First, high oxygen levels can be directly toxic to certain types of bacteria. We're talking particularly about anaerobic bacteria, the ones that hate oxygen, and often cause really nasty wound infections. Flooding the area with oxygen makes it a hostile environment for them.
So it attacks the bad guys directly.
Yes, but it also boosts our own defenses. Hyperbaric oxygen significantly enhances the ability of our white blood cells, leukocytes and macrophages, to kill bacteria. Think of leukocytes as the first responders, macrophages as the cleanup crew. Their mechanisms for destroying bacteria often rely on oxygen. They have these oxygen-dependent killing pathways inside the cell.
Right.
And these pathways work much more efficiently at higher oxygen levels. The enzymes involved have an optimal range, often cited around 40 to 80 millimeters of mercury, which hyperbaric therapy can help achieve.
So it's a double whammy, hurting the anaerobes and supercharging our own immune fighters. That sounds really effective.
It is. And there's another layer too. Some research suggests hyperbaric oxygen can actually make certain antibiotics work better.
Really? How?
Things like aminoglycosides, cephalosporins, quinolones. The thinking is that the high oxygen environment might help these drugs get transported across the bacterial cell wall more effectively. Some studies have actually shown fewer bacteria when antibiotics like cephalosporins are combined with hyperbaric oxygen compared to the antibiotic alone.
Wow. It seems to be hitting all the major problems: poor blood supply, slow healing, swelling, infection. Is there anything else it helps with for the graft or flap to really take hold long term?
Yes, and this is crucial for lasting success, promoting the growth of new blood vessels. We call this angiogenesis or vasculogenesis. For a graft or flap to truly survive and integrate permanently, it eventually needs to develop its own robust blood supply in the new location. Hyperbaric oxygen therapy has been shown to stimulate this process.
How does it do that?
It seems to involve upregulating or increasing the production of certain growth factors. A key one is called vascular endothelial growth factor, VEGF. Think of it as a chemical signal telling the body, we need more blood vessels here. Lab studies using human cells have shown that hyperbaric oxygen can trigger specific signaling pathways inside the cells, like the SAPKJ and KK and ERK pathways, leading to more VEGF being produced.
So it's not just providing a temporary oxygen boost, it's actively telling the body to build the permanent plumbing, the infrastructure for that tissue.
That's a great way to put it. It helps bridge the gap until the body can establish a self-sustaining blood supply to the graft or flap. It's a really remarkable long-term benefit.
Okay, this all sounds incredibly promising. Let's talk practicalities. How is this therapy actually delivered? What's the setup like?
Well, one common way is using what's called a monoplace chamber.
Mono meaning one person.
Exactly. These are chambers designed for a single patient at a time. They tend to be more cost-effective than larger multiplace chambers and can often run off a hospital's standard medical-grade oxygen supply. They typically look like a clear acrylic tube, maybe 2 or 3 feet across. That clear wall is important better. Staff can see the patient easily, and it helps reduce feelings of claustrophobia for the person inside.
I can imagine.
Oxygen flows in at a pretty good rate to fill the chamber, and then the pressure is increased. And they've developed equipment that can work in this environment. You can have intravenous pumps delivering medication, even specialized ventilators, often placed just outside the chamber with lines going in. They've also figured out automated, non-invasive blood pressure cuffs that work inside.
So even if someone is quite unwell and needs close monitoring, they might still be able to get this treatment.
Potentially, yes. Things like ECG monitoring for heart activity are standard. And with the right expertise and equipment specialized ports in the chamber wall, you could even do things like direct arterial blood pressure monitoring or take blood gas samples during the treatment. This allows for very close physiological monitoring, even for quite complex patients.
But is that common, managing really critically ill patients in these chambers?
That's an important caveat. While it's possible, currently not many hyperbaric units, especially those primarily using monoplace chambers, have extensive day-to-day experience managing truly critically ill, unstable patients during the hyperbaric treatment itself. It requires very experienced staff and specific protocols.
Okay, so the capability exists, but widespread practice for the most critical patients might still be developing. Good to know.
There is one potential theoretical concern sometimes raised, the idea of free oxygen radicals.
Ah, yes, the idea that too much oxygen could be harmful.
Exactly. High oxygen levels could theoretically lead to an increase in these reactive oxygen species, which can damage cells. However, the body has natural defenses against this antioxidant enzymes, things like vitamin C and E. And it's also worth remembering that the opposite state, hypoxia or lack of oxygen, can also worsen tissue damage through oxidative stress. So it's a balance. Generally, the benefits in these compromised tissue situations are thought to outweigh this theoretical risk, especially with standard treatment protocols.
Right, the body has systems to cope, and the alternative tissue death from lack of oxygen is much worse. Okay, so let's try and wrap this up. If we boil it down, what are the absolute key takeaways about using hyperbaric oxygen for these trouble grafts and flaps?
I'd say it's a powerful multi-pronged attack. First, it dramatically boosts oxygen delivery right where it's needed, bypassing limitations in blood flow by dissolving oxygen directly into the plasma using pressure. Second, this extra oxygen fuels essential healing processes, cell growth, collagen production. Third, it helps manage complications like swelling and infection, both by hindering bad bacteria and enhancing our immune response. And finally, crucially for the long run, it stimulates the growth of new blood vessels, helping the graft or flap establish its own permanent lifeline.
And for me, the really striking thing, the aha moment perhaps, is just how cleverly we can use a fundamental principle, pressure, to deliver something so basic, yet so vital, oxygen, directly to tissues that are literally fighting for survival. It provides this critical advantage when the body's normal systems are just overwhelmed. It's quite elegant, really.
It is. And for you listening, this probably sparks more questions, right? Like, which specific types of graft or flap problems respond best? What does a typical treatment course look like? How many sessions? How long? What are the actual success rates we see?
Definitely. You want to know, okay, how well does this actually work in the real world?
Absolutely. And for that level of detail, searching reputable medical sources is good. But if this is something relevant to you or someone you know, the best step is always talking with healthcare professionals who specialize in wound care or hyperbaric medicine. They can give tailored advice.
Good point. And thinking beyond just grafts and flaps, it makes you wonder, doesn't it? If we can manipulate oxygen delivery so precisely at the cellular level using pressure for this problem, where else could this principle be applied? What other kinds of tissue damage or repair challenges might benefit from this approach in the future? It certainly gives you something to think about.